Within the coming weeks, Missouri healthcare providers will be able to track a patient's prescriptions with the goal of preventing overdoses and opioid abuse. Our Missouri Chief Capitol Bureau reporter Emily Manley explains where the state stands on creating a prescription drug monitoring program. She is live from Jefferson City tonight. Emily.
Jordan, Missouri is actually the last in the nation when it comes to having a statewide prescription drug monitoring program. Already about 75 counties do have some sort of program, though, in place. But after a law that was passed back in 2021, all Missouri providers will be required to input their patients' information into this program. And if they don't, they will be penalized.
Ultimately, it is to provide the best care for the patient and decrease loss of life in the state of Missouri.
Overseen by a task force of licensed healthcare professionals, Missouri's new prescription drug monitoring program, or PDMP, will allow physicians and pharmacists to track a patient's prescriptions.
But it will alert the providers to, okay, you had a discussion on a millimorphine equivalence earlier. If it gets into a certain range, this is going to be something that will be red flagged.
Dean Linneman is the program's executive director. He says the state is currently in the implementation phase. About 85% of the state's population uses a database from St. Louis County.
We're working through some processes with St. Louis County to get that information transferred over.
The database will not track all prescriptions. Instead, the drugs are based off the ability to become addictive or probability of abuse and include Scheduled 2, 3, and 4 controlled substances like morphine, Vicodin, Oxycontin, testosterone, Xanax, or Ambien. Linneman telling the Substance Abuse Prevention and Treatment Task Force last month the state is still working on an exact go-live date for the program.
Once that's able to be determined, we will, about 4 to 5, 6 weeks maybe, prior to that go-live date, we'll start a communication campaign.
The program is supposed to reduce doctor shopping by patients who are seeking multiple prescriptions for painkillers. In 2021, nearly 2,200 Missourians died from an overdose.
We want to make sure that the providers, dispensers have the ability to look at what they're prescribing, look at what they're dispensing, with the history of the patient that they're providing the prescription to.
Now, once the state's PDMP is available, the St. Louis County program will dissolve. Last week, when the governor signed the budget into law, he appropriated nearly $2 million for the database. If a provider does not input a patient's information once this program is live, he or she could be fined up to $1,000. Reporting live tonight from Missouri State Capitol Bureau in Jefferson City, I'm Emily Manley, Fox 2 News.